Hi, I'm Heather Watson, and I'm a physiotherapist with Therapia. Today we're going to talk about how to get your quadriceps or thigh muscles working again right after surgery. We are going to cover 3 simple exercises to get your quads going: quad sets, quads over roll, and straight leg raises. A quad set is the simplest exercise and the one you should try first. Simply place a small towel folded under the back of the knee. Tighten up your thigh muscle to push the back of your knee down into the towel and hold for 5 seconds and then release. You may wish to feel the muscle with your fingers to know you are activating the quad. You may find this will take a bit of practice and the muscle will not want to contract right away. It may feel twitchy or uncomfortable, but stick with it, and within 5 to 10 minutes, you will get that muscle to fire. Once you are able to do this for many repetitions, you can attempt the next exercise. For a quads over roll exercise, you will need a foam roller or a rolled up pillow. Simply drape your knee over the roll. Begin by pushing the back of your knee into the roll and maintain gentle pressure for the entire exercise. Next, use your thigh muscle to straighten the knee as much as you can. Hold for 5 seconds in the fully straight position and return to the start position. It's important that you don't lift the back of the knee away from the roll. When you are able to do this exercise easily for many repetitions, you can add straight leg raises to your routine. Straight leg raises are the most challenging exercises in the series we are going to do today. You should be able to do the other exercises with no issues before attempting straight leg raises. Begin by activating your quadriceps muscle by pushing the back of the knee down into the floor. Once this muscle is fully contracted, lift the entire leg up to 45 degrees without allowing the knee to bend at all. Hold for 5 seconds and return to the start position. Once a patient is able to do this exercise for 10 repetitions without the knee bending, they are usually able to walk safely without a gait aid. You may be asked by your surgeon to perform this exercise at your first follow-up visit. If you follow these progressions and are dedicated to these exercises, you will have your quads working in no time, ensuring that your surgeon will be very pleased with you on your follow-up visit. You will also be walking more safely and more confidently. For help with these exercises and more, talk to your Therapia physiotherapist. They have a wealth of knowledge and many more exercises to help you get back to full function.